New Mexicans at risk because of their poor living conditions. But whose job is it to make sure they get the help they need? In tonight's special assignment, News 13's Kim Holland gets answers.
It's an incredible way to live. We're not talking about the stunning views, but what's tucked away on this property in Harris. The clues line the driveway: jugs of water, old Coke bottles, an old kid's bike, and heaps of trash. But you ain't seen nothing yet. To find your way to this man's house, you have to wind your way through a hoarder's maze. Junked vehicles, even old TV cameras. It's just overwhelming. And so is the smell. The homeowner has rotting, moldy liquids in buckets near the front door and food sitting out in the sun. The homeowner was embarrassed to be on TV, but admits it's out of hand.
It's gotten messy, and I'm trying to clean it up.
It was hard enough for us to wade through the clutter to talk to the homeowner, but he has a paid caregiver who has been coming once a week.
She just had some concerns about getting in here and helping you. If somebody could come in here and help you clear out some of the stuff to get access to your house, would you welcome that? Or you don't want that?
I do have help.
The caregiver says this man doesn't have running water. She says neither does the elderly man who lives here in Moriarty. The caregiver says he hasn't had water in 38 years. He relieves himself in the backyard. The caregiver works for Addis Home Care. The business operates in 23 states, including New Mexico.
We assist our clients with the activities of daily living: bathing, dressing, grooming, meal preparation.
Their services allow their clients to stay in their own home. But at what cost?
The employee who tipped us off about her clients and the unsafe and unclean living conditions complained to her managers here. She says her managers told her that some clients just like to live that way and that it was her responsibility to clean up some of the mess. We called corporate office for answers.
It's a fine line. It's very difficult sometimes, to determine, is someone of a diminished capacity that they are, self-neglecting, and therefore, we need to report that, or is it just someone exercising their right to live sloppily?
Addis said in situations like these, it would report the unsafe conditions to the patient's case manager, whether that be Medicaid or their private health care provider.
Addis promised it would contact the caseworkers of the 4 clients we told them about. We also contacted Adult Protective Services that said it would help too.
But it's dire. The caretaker said she's even seen snakes and dead rats in her clients' homes. Concerned for her own health, the caretaker stopped going to 2 of them. Addis Home Care wrote her up. Kim Holland, KRQE News 13.
The Addis employee said once the local manager found out that she talked to News 13, that manager said, "Now you're really going to get it." News 13 reported that threat to the corporate office.